specialists in this subject, um, and others may have actually used CBT therapy, right, for yourself, for example. And what it focuses on is increasing engagement in meaningful and rewarding activities. And as I kind of in this first bullet point here, it's based on the principle that mood and behavior are linked. So how we feel affect how we behave, or how we feel impact whether we do something or don't do
नहीं
something,
आपकी
whether we
आवाज
avoid
नहीं आ रही।
something. Um, and what the kind of key aim of BA is to break that cycle of avoidance and withdrawal, because from lived experience or dealing with clients, we know that even mild depression, so mild, moderate, severe depression, one of the key things that we observe is withdrawal and not kind of falling out of routine, for example, having a lack of routine and not doing leisure activities, and then kind of it might also lead to not doing your basic self-care. So it's not just about, you know, not doing things that are enjoyable, but also it's about clients or ourselves doing less of the things that we need to do to maintain ourselves in the day-to-day life. Um, and yeah, so re-engaging with enjoyable activities helps to improve our mood, and it helps us to kind of have something to aim for during the day, because a lot of the time kind of you want to stay in bed, or kind of stay in one room, you don't want to socialize. That's kind of a uh common attribute in people with depression or with depressive symptoms. And so that's the kind of rationale behind BA in the context of depression. And yes, so restoring routine and purpose. So when we don't have a routine, the day can feel very unstructured, right? So it can feel like, okay, I've got so many things to do, and then we might not end up doing uh any of them, right? Or maybe just one. And then we kind of that might lead to feelings of guilt, for example. And this can often be the case in people with depression. They don't have a routine, they may not have a plan for the day, and so they're kind of stuck in their mind, right? Because they would often know to redirect their thoughts to. If anything doesn't make sense or you'd like me to elaborate, please do write in the chat. I will try to have a look in the chat as I go along. But that's kind of the basics of BA and what it's all about, really. In terms of empirical evidence, so what does some of the research say? It's all well and good being told that, oh yeah, BA is very, it's great and it helps with depression, but we often need to look at the research, right? Or always look at the research, especially for when we're dealing with research to do with people, for example, in mental health, right? Similar thing with education. Um, to teach well, you need to kind of know the theories. So I've collated a few of the kind of key findings, kind of research methods type findings about BA for depression. So some of these terms might be familiar. I've tried to keep any kind of specialist terms out and tried to make it as simple as possible. But if anything doesn't make sense, please do mention it in the chat. I'll just have a look now. Yes, yes, Abira. Daily activities like brushing your hair, absolutely brushing your teeth. You know, if you need to have a shower, that thought of that mental anticipation of I've got to get fresh towels out and then I've got to get my clothes out. Oh, what shall I wear? It's warm or it's cold. Um, you know, I need to warm the bathroom up first. I need to do this. So a simple task of having a shower, even just imagining or planning for it in your head can feel tiring. And then after all that thinking, sometimes you just think, I'll do it tomorrow, or I don't have enough energy for it. So that's, yeah, that's one of the ways in which it can affect people. But yes, the empirical evidence. So it has been found that it's as effective as CBT, so cognitive behavioral therapy. And what I mean here is that it CBT as in one-to-one, kind of with the therapist and the client. So BA is a sort of intervention as part of CBT, right? And it was BA was found to be superior to no treatment. So imagine you have three groups of people, right? So the individuals with depression who didn't have any treatment, so no BA was kind of taught to them, no CBT was given to them. Then you have group B or group two, and they were given CBT, so one-to-one sessions, which is the traditional kind of format. And then the third group would be the BA group, for example, right? So, or not for example, but in this study or in several studies, and they found that BA, compared to the people who had no intervention, it was significantly impactful. So it is making a difference, and it does make a difference in reducing symptoms. And the fact that it's as effective as the traditional CBT, so the full CBT, if you like, sessions, shows that this behavioral activation is actually quite versatile, and we'll talk a little bit more about that as well in the next few minutes. Scalable. So there's quite a bit of evidence to show that BA is scalable. Now, I feel like this is one of those terms which is a bit kind of a bit of a buzzword. Kind of we see this a lot in research papers and things like that. But what this means is, let's say you have a group of 50 people and they have been administered BA, right? So behavioral activation. Um, and they've been taught BA and how to kind of practice it. Now, 50 people, that's great. But what about the rest of the population, right? What about the wider population? So scalability is thinking, okay, it helped. In this case, BA has helped this group of people. But if we increase the number of people that we give it to, would it still hold up? Would it still be helpful? And would it still significantly improve symptoms? Let me know if any of that is confusing. I'll check the chat again. Good question, Hamna. So, will BA be effective for people with severe clinical depression? If they don't see any point in daily tasks, how can we convince them to still carry them out? That's an excellent question. So, for people, of course, every individual is so different, every case is so different, right? You can have two people with a diagnosis of clinical depression, um, but one of them might respond really well to BA. They might think, oh, this is great, and they're able to re-engage in their hobby, or re-engage in physical activity. But you might have, person B who you deliver BA to, behavioral activation to, but it doesn't help them at all. So that's this might sound like a cop out kind of answer, but um, if it doesn't kind of help them, then perhaps what clinicians might do or a doctor might do is administer medication, perhaps. So it could be that I'm not an expert in that particular field, but if, for example, a client might benefit from a low dose of an SSRI, for example, an antidepressant, and then once they've kind of maybe after kind of 6 months of once they're stabilized on that medication and they kind of inshallah finding some benefit from it, then at that point they could retry BA or be introduced to BA, because then it could be that they have that a bit more energy and they have that kind of clarity and kind of they feel a bit more balanced and able to engage. I hope that answers your question. Um, how can we keep them accountable? We'll come back to that later. We'll come back to that later. Um, so it works remotely as well. So scalable. BA is very scalable and it works remotely as well, so it can be used as a digital intervention. Now, this is um, probably maybe not so surprising given, the COVID pandemic and with everything going online, right? And that's kind of led to lots more people working from home and lots of digital interventions, things like that, apps. Maybe some of you here use apps, for example, like Headspace, Seven Cups, things like that. So that's a great advantage of BA because it gives it versatility, so you can administer it theoretically on an international level, right? Um, Cost effective, so especially compared to one-to-one or group CBT. We've got therapists, they're amazing, mashallah, but it is very expensive, of course, for, governments and kind of funding, things like that, to administer these interventions, especially in, for example, group settings, where you've got maybe a hospital of, 5,000 people, 5,000 patients who would benefit from BA, but all these kind of behind the scenes sort of costs as well. So all of this we have to take into account when we're thinking about, okay, this intervention works, but how many people can it actually help? Um, so cost effective, that's a big plus for healthcare systems, for example. Less training as well. So you don't have to be a CBT therapist or a clinical psychologist to administer BA. It's less training intensive. You don't need, for example, a master's or a PhD, etc., to administer it. So that's another great point as well, because if there's less training required, then more people, inshallah, can administer it, and we can therefore help more people. So that's another advantage. Um, I'm just checking the chat again. And culturally adaptive. So the nature of BA, which we will come to a little bit later as well, it's quite readily adapted to different cultures and faiths. Um, in terms of, for example, behavioral activation, so the actual behaviors that we're encouraging clients to re-engage in, or ones that we are helping our clients to engage in, ones that they've thought of themselves that they want to do. It's readily these tasks are kind of readily adjusted to make them aligned with our faith, for example, Islam, right? Person-centered. So what I mean by this, you might have heard of person-centered care, person-centered therapy. So I feel like BA is very much, and it's supported by evidence as well, is very much a person-centered intervention. It's not about saying to, so and so client, oh, do this, do this, do this, right? It's about, yes, we can make suggestions, but they're very much in control. So they decide when they're going to do a certain activity. They decide how long they're going to do it for example. So it's great in terms of empowering our clients to be autonomous and take control of their lives and inshallah improve their mood as well. I'll just check the chat. How does increasing positive reinforcement in BA therapy interact with the cognitive behavioral model of depression? So, behavioral activation, it is part of the behavior part of the CBT cycle. So, you have cognitions, behavior, emotions or feelings, and you have physical sensations as well. But the main thing is cognitive behavior, and then the emotions. So BA fits into that behavior part of the cycle. So withdrawal, if somebody's feeling depressed and or anxious, they don't feel like doing their usual stuff, right? So their routine things like brushing their teeth, showering daily, for example. So where BA comes in is BA says, hypothetically, BA teaches us or our clients, do this one small thing, one small action that you can do to help improve your mood. Hopefully that answers your question. Um, right. So been talking about the research, we've talked a little bit about what BA is, but how do we actually implement it, right? As clinicians, as trainee therapists, as people with friends or family, ourselves with low mood or depression, for example, how do we actually implement it? Now, this what I'm going to go through is not exhaustive, but I've tried to kind of pick up some of the uh, key points here for you to kind of take away, inshallah. So, number one, this kind of framework, this kind of five-step framework, can be used. So, monitor activity and mood. So, these are five steps. So, monitoring activity and mood. This I think somebody mentioned in the comments a few minutes ago. So the importance of monitoring things when you're practicing BA is simply you have a plan, right? So you have a plan for what you're doing and how well it went. So you're monitoring, for example, uh, on Monday or this week, every morning I did 5 minutes of dhikr, or if it's a non-Islamic activity. I went for a walk around the garden for 5 minutes every morning this week. When we when we write down our mood as well, when we record the activity and then the mood, what's really helpful is the before and after. So, how did you feel before the activity? How did you feel after? And a key point is that a lot of the time you won't, it might be that before the activity you felt 2 out of 10, right? You felt rubbish, you felt, sluggish, for example. And then after that 5 minute walk, it might be a 2.5, or it might still be a 2. That doesn't mean you're doing it wrong or that your clients are doing it wrong. Absolutely not. It's like gardening, for example. If you put your seed in the soil, I'm not a gardening expert. If you put your seed in the soil, and you put some water on it, if you check it after 5 minutes or an hour, are you going to see a massive plant? Feel free to tell me in the chat. If you do see a massive plant, I want to know which seeds you're using. um, yeah, perfect, right? Um, so just like that, it could take weeks, it could take months. So it's really important that we support our clients, or our peers, etc., with uh, with making realistic plans and with monitoring how things went. And yeah, being patient with things. Number two, identifying values and small goals. So values, um, I'll come into that in a little bit more detail in the next slide, but it's about what's important and then making goals based on that. Create an activation menu. So this is essentially a list of behaviors or mini tasks that the person would like to start re-engaging in. Of course, not all at once, but it's kind of like that menu, exactly like what a menu is, right? Instead of food, it would be a list of behaviors, right? So a 10-minute walk, or since we're talking about gardening, plant something every week, or spend 10 minutes in the garden every morning, that kind of thing. Um, Scheduling, so links quite a bit to number one that I mentioned. So making sure you say when you're going to do it and not just, next week or not just on Monday, because that's very vague, right? So, and it doesn't have to be, Monday at 2:03 p.m. for 3 to 4 minutes. It doesn't have to be as specific as that because it can be a bit tricky to kind of ascertain, kind of think about very, very specific timings. But a good place to start would be the day and what time of day and roughly for how long, a time range. So, Monday, I'm going to plant some seeds in my garden or spend some time in my garden for 5 to 15 minutes. So that kind of lowers the pressure a little bit, right? So you can 5, 10 minutes, 15 minutes on a good day, right? And then that would be, for example, in the morning, the afternoon, the evening, whichever time feels best, right? And then review and adapt. So again, this links to the monitoring. So at the end of each week, perhaps, or maybe at the end of, every 2 weeks or so, it's really important to think, okay, what did I manage to do? What did I not manage to do? It might be that a client um, acknowledges that they didn't get any of their tasks done. So at that point, it's really important as a therapist or as a mental health practitioner to give them that one-to-one support and to encourage them, right? And to be careful with the language that we use when we're kind of evaluating their progress. Okay, so a little bit more detail in on kind of what I said and kind of adding some bits. So the values grid. So identifying values. These are some values that are kind of common. So faith, religion, culture, family, health, work, leisure. So these are kind of categories. And by grid, I just mean you could one line horizontal, one line vertical. There you go. Put one value in each. So it's not kind of a fancy grid. It's just having some sort of visual there to categorize these. And you can choose one value. So for each week or each day, you might choose, okay, health, and then one small action. So a 5 minutes up and down the stairs. It might be so somebody's in bed a lot. It might be 5 minutes. Go down the stairs, or just walk to the garden, or stand on the balcony for a bit. If you're lucky enough to have a balcony, it's kind of feeling the fresh air. Maybe you have plants on the balcony, that kind of thing. So yeah, have your values grid, one small action, and that kind of keeps it fresh as well. So you've got kind of a variety of values to choose from. And then a tiered activation menu. So what I mean by this is just one approach. Um, but what I mean by levels or tiers, so level one might be uh, for each behavior, for example, physical exercise, that might be your action for the value of health. So level one might be 5 minutes around the garden. Level two might be 15 to 20 minutes walking around the garden or sitting in the garden with a friend or with a family member. So spending out time outside with somebody else. And then tier three would be kind of the most ambitious one. So, for example, 30 minutes in the local park, right? Or it might be 10 minutes in the local park. And that would be a step up from 10 minutes in your garden, right? So you're kind of challenging slightly and gently. Scheduling, so make it specific, make it achievable, make it so to begin with, make it really small. And what I mean here by low friction, so if a task or behavior is high friction, that means there's multiple steps needed to achieve it. So we want uh, these behaviors to be low friction, i.e., kind of minimal effort. Um, yeah, so monitor activity and mood, like we mentioned. Just adding to that, what was the activity, mood out of 10 or out of 5, whatever, and then a brief phrase or a sentence about how it felt or kind of what the experience was like, just to give a bit of context, for instance. And then lastly, review and adapt. So, like I mentioned earlier, how can we evaluate our performance? And with clients with moderate to severe depression, this would likely require kind of one-to-one support from the therapist or the practitioner helping them. to help them think, okay, let's maybe break it down, or let's remove all these options and let's stick to 1 to 2 behaviors for each week, for example. Yes, the if then strategy. So this is kind of planning ahead. So if I don't walk for 10 minutes in the garden, so let's say you're in bed and you're kind of looking at your schedule or whatever, and you think, oh, I really don't want to do 10 minutes. I really don't want to go 10 minutes in the garden. Then then so if I don't want to go to the garden for 10 minutes, then I will walk around the stairs or walk around the hallway for 10 minutes. So it's kind of like a backup kind of thing. And that can help a little bit as well. Okay. I will just have a look in the chat. I can see that there's messages. If your environment isn't convincing or if it's unhealthy and it's disturbing them, yeah, it can affect their how quickly they kind of restore, like you mentioned, restoration. So absolutely your physical environment, your living conditions, all of these wider factors, absolutely things like socioeconomic status, all these things can affect how quickly you recover. Absolutely. Okay. So the Islamic perspective. Um, so just some key hadiths and kind of a few points that I wanted to go through just to kind of give a little opening into how we might think of BA in terms of an Islamic perspective. So the first hadith here, I think this is quite a popular one that many of us would be familiar with. So the most beloved deeds to Allah subhanahu wa ta'ala are those that are consistent even if small. So actually in the chat, how do you think this links to BA? Let's see if you can answer it for me. I think this hadith really nicely summarizes BA. I'll give you a minute or so. How do you think this first hadith is relevant to BA? Ali, put your question in. So, how can BA help counteract patterns of avoidance reinforced over several years? Great question. So, for that, I would suggest perhaps getting in touch with your values. So, who you were, a month ago is may well be very different to who you are in the present moment. And so who you were a year ago, 2 years ago, will also be very different. So doing a kind of values check-in, like a kind of life audit type thing can help. Yes, excellent, Manaz. Yeah. BA focuses on small, consistent steps to achieve client goals. Exactly. Yeah. So it helps with psychosocial issues. Brilliant. The second kind of hadith we've got here, indeed, with hardship comes ease. So often with BA, behavioral activation, we always think of hardship, right? So with mental health conditions, we think, you know, why was I the one who had all these health conditions, physical health conditions and mental health conditions? I feel so low, even though, I'm reading all of my namaz, or all of my salah, I'm doing this, and this, or my whole life I've been absolutely fine, and now I'm kind of coming into this mental hardship. But what Islam teaches us, what the Quran teaches us, is that experiencing hardship in um uh experiencing hardship in life isn't doesn't mean that you're not doing you're not being a good Muslim, for example. What it means is that you're a human being, right? So we weren't created to be flawless, right? We've got free will. We're able to choose what we do. We're not infallible like the angels, right? So it's inevitable, it's inescapable that we are going to have hardships, and it's what we learn from that, and it's how we teach others, our family, our peers, our community, that look, I went through this mental health condition, and it was difficult, but with hardship comes ease, right? So we can kind of appreciate what we've been given by thinking about times when we feel like we've had things taken away from us. For example, mental health. Um, Quick look in the chat. Firm belief, Surah Qaf. Yeah, on Fridays. My sister always reminds me to read Surah Qaf. Samiha, does BA help patients with suicidal thoughts? Um, Good question. So I would say BA, whilst I'm not an expert on that subject, I would say BA would not perhaps be suitable for clients or people with kind of suicidal thoughts, and a safety plan, a careful safety plan should be made with that individual to help them navigate that. Salah and structuring routines. Let me just get rid of this. There we go. Um, Salah and structuring routines. So what I mean by this is we have our five Salah during the day, right? So Fajr all the way until Isha, and one way we can help our clients or ourselves, peers, etc., to establish BA routines, are to connect them with Salah times. So maybe not Fajr, but maybe if you're a very early riser, um, I'm working on being an early riser, inshallah. But yeah, so for those of you who naturally wake up in the morning and start your day at kind of Fajr time, um, Fajr time might be that perfect time to do that activity, that 5 minutes of journaling, reading those 5 pages of a book, for example, or listening to a 2 minute podcast, or 2 minutes of a podcast. Um, Charity does not decrease wealth. Another very popular hadith. And can anyone guess? This is a bit of an abstract point, but can anyone guess how I might link this to BA? And yes, Amira, believing that Allah does not burden a soul beyond that you can bear. Absolutely. Yeah, that's a great one, mashallah. Rubina, I'm glad you agree with according to Salah, persistency. Yeah, I'm helping others. Pain doesn't break you, inshallah. So my reason for putting this hadith on is the idea of is kind of contradictory in a sense, right? So charity, often when we think of charity, we think of money, right? So donating, so giving away money. But the hadith says charity does not decrease wealth. Wealth, we think of, it can wealth, can be a health as well. Health is wealth, as my mom says. So it kind of sounds contradictory. Well, charity is kind of giving things away, but wealth is gaining things and having things. So, how does that work? But we know, as somebody mentioned in the chat, it's kind of about gratitude and serving the community as well. There's lots of research to show that giving charity, not just money, but giving our time, right? Uh, giving peace, kind of just listening to somebody, giving somebody our precious time, our energy, is also an act of charity, right? It's not just money or clothes or material things. And so this links to BA because when you've got individuals with um, mild, moderate, severe depression, either one or all of them, you don't want to do anything, right? So the the thoughts in your head and your body often tell you, I don't want to do anything. I want to stay here, safe in my bed or in this kind of space. And that's kind of the circle of safety, right? That represents safety for that person. And getting out of bed, facing the real life outside of their room, for example, represents danger. It represents emotional unsafety, right? So that's the kind of link between this hadith and BA, that they both seem contradictory. Let me know if that doesn't make sense in the chat. Oh, I can see lots of messages. Yeah, you're absolutely right, Sabina. It can be hard to um kind of encourage or kind of inspire certain individuals with severe depression on what to how to help these clients. Again, complex question with lots of possible different answers you could get from people, but perhaps kind of giving somebody a low dose of an SSRI, for instance, um, as a kind of holistic approach, so talking therapy, and then medication. So to help them, I think I mentioned this earlier. So medication, kind of a pharmacological intervention, can help that person sort of maybe stabilize. And then of course evaluating how that's going, side effects, things like that. And maybe things like family therapy, that or internal systems therapy, that kind of internal family systems therapy. So it might require a variety of approaches, and not all at once, of course, but that's kind of for the counselor or the therapist to kind of decide on based on their clinical intuition. Reading one letter of the Quran is promised a reward of 10 good deeds, right? So 10 times the reward. How do you think that links to BA? Sana, if we help others, Allah makes things easy for us, inshallah, yes. Yeah, Hamna. So we don't want to impose religious activities on individuals, right? The uh if individuals feel like they're being, put into a corner and being sort of even coerced, we could say, it's kind of a strong word, but coerced into um, practicing the religion. Oh, you should be doing this, you should be doing that. Yes, whilst that might be true that they, for example, should be reading the Salah if they're past puberty, um, kind of, nagging them, especially young people, may not be the best approach. Or, for example, if you've got a revert, for example, to Islam, subhanallah, um, if they've got kind of depression and they're kind of trying out CBT with Islamic informed approach, or just in general, if they're trying to connect with their religion whilst feeling low, um, that that can be quite difficult for them. So it's important to think about our language and to be empathetic with them and to kind of just pause before we we kind of give unsolicited advice sometimes. So I think sometimes it's kind of misguided, um, well-meaning but misguided support that we can give. Hence, professional support is recommended if needed. Yes, listening to Azan. Yeah, definitely. Okay. I won't read these out, but just a few bite-sized faith-based ideas. So reading 1 to 5 ayahs, short dua list, texts to friends, 2 to 5 minute clips, just kind of these small micro tasks um, that we can help our clients or ourselves, friends, to try out, especially if maybe part of the one of the contributors to their depression is that they're feeling disconnected from their faith. So that might be a contributor, but it also might be something that's making their depression worse. right? So a sense that, God doesn't love them, for example. Okay, I was looking forward to this part, inshallah. So, I know a lot of you in the registration form, those of you who completed it, um, really wanted kind of practical focus. So I've got a case study here. It's a mock case study, so any resemblance to a real case is purely coincidental. But have a read through, um, and I'll give you kind of 2 or 3 minutes, maybe 4 minutes, to think about how might you help Sarah with BA, using BA. What are your thoughts? I'll give 1 more minute. So how could BA be used to help Sarah? Any ideas? You can unmute if you want to. Okay, just in the interest of time. So one way we can see that Sarah used to love drawing and journaling, but hasn't touched her sketchbook in months. So we can see that there's a hobby there, there's an activity that she used to love doing, she used to engage in, that used to bring a sense of achievement and pleasure. Um, and so we could try to slowly introduce micro actions into Sarah's life, right? So the monitoring, the 5 steps that I mentioned earlier, we could use that as a framework. So drawing or journaling, so it could be 5 minutes in the mornings. Um, for drawing, that's kind of very broad. So it could be micro task in terms of how long it takes, but also what she's drawing. So something small, something simple, um, to get her started and kind of create that momentum. Oh, I can see chats coming in. Yeah, excellent, Hamna. So work on that feeling of shame and guilt. Absolutely. Um, so this thought, um, what's the point when I've already missed so much salah? So we can absolutely focus on that shame and guilt first, um, and then we can think about introducing BA perhaps, or we could kind of see if we could address maybe the BA as her independent task, and then maybe with her a mental health practitioner, with her therapist, we could kind of unpack that kind of shame and guilt and think about in that CBT cycle how those thoughts affecting her emotions and her behavior. So perhaps that professional support could be used, could be needed, to really unpick those thoughts.
Okay, so basically, I
Okay.
think for
Yeah.
Sarah, for her lack of emptiness and lack of motivation, she can just start with she can take small baby steps, and she can just start with one step ahead. Like if she didn't touch her sketchbook for months, she can just take out 5 minutes and start doing it initially, which is to be linked with her feelings. For example, she's already having so much negative emotions, so we can tell her that you can allow her to process these emotions without any judgment. And for this negative criticism and dialogue, she can eventually work on a positive self talk with herself. in which will make her feel better about herself and then eventually getting back to the normal activities which are pleasurable for her.
Beautiful. Yes. Yeah, inshallah, absolutely. I think that's a great response. I think you've kind of summarized it very nicely. That's definitely a valid uh possible answer, possible way to help Sarah. We will do, I had three, but I think we will do two, if we don't have enough time. But we've got a slightly shorter one. So we've got Yusuf, 45, father of three. And again, you can unmute if you like, or put it in the chat. How could we use BA based on what you've learnt today, based on your prior knowledge, your prior experience? How could we help you, Seth? Any thoughts? So, one way we could perhaps intervene here with Yusuf is addressing the not spending time or not spending enough time with his children, right? So he feels guilty. Well, his wife as well. So he thinks that his wife deserves a better husband. So there's those kind of maladaptive thoughts there, right? So feels guilty for not engaging with his children. So perhaps maybe they kind of eat dinner together, but they kind of don't. There's not that father-child playtime kind of thing, right? A lot of research and attachment kind of highlights the father's role as being that kind of playmate. Um, for those of you interested in attachment theory, you might have kind of been familiar with that. Um, so, what could be one small task, one small way, maybe when he comes home or in the mornings, for example, where he can engage with his children? Minaz, exactly what I was thinking. You read my mind. Yes. So, reading a story at bedtime, right? Or on the way home from work, kind of getting a teddy or a little kind of gesture, and then kind of tucking them in bed with that teddy, for example. Of course, not a teddy every day. I can imagine how full their bedroom must be at the end of the week. But yeah, a bedtime story. And we know stories help children build empathy and emotional connection to characters, especially if they can kind of see themselves in the story. So they're, for example, reading a story about a Muslim girl, for instance, or reading a story about how to read your salah, things like that, or stories of the prophets, right? So bedtime story, absolutely, or just tucking them into bed, saying, I love you, Allah Hafiz, um, I'll see you tomorrow, or kind of just making a little joke before bed, that kind of thing. So just a little interaction to end that day on a positive note, and then they can kind of inshallah go to sleep with uh their father in their mind, right? Okay, let's just have a look. I think we just about might have enough time to look at Chloe. Just about. So you've got about 5 or 6 minutes left. So this is the last one. So let's look at Chloe, who's a non-Muslim. 31. She works in marketing, which is a bit of a workaholic, we might say. Any ideas? So this is her case. How might how might we help Chloe using BA? And yes, Hamna, I've just seen your message now, 5 minutes with friends, yeah? So maybe fellow taxi drivers, Yusuf could kind of give them a phone call before his shift, after his shift, to kind of make friends, yeah? Yeah. So they could start with a shower, and one way that could be made more digestible is, so let's say it's a Tuesday. So Tuesday night, get the towels out, get the clothes out, um, and just mentally prepare and remind yourself, okay, at this time I'm going to do it. And then yeah, just helping that individual, helping Chloe, to her, it might be her friends, or it might just be that moral support from the mental health professional. It might be herself, just kind of giving herself a little pep talk and thinking, okay, everything's out. All I need to do now is get to the bathroom and just walking out. And of course, it might that might still be difficult for her, but again, it's an individual basis. So some individuals might find that it's doable, others not as much. So instead of showering, it might be skincare, for instance, because that way she would kind of stay in her room, but at least she's doing something. At least she's engaging in an activity. Clean her room, practice. I mean, perfect. So maybe cleaning the whole room would be too much. Maybe emptying her bin, right, on her way down to the kitchen to make coffee or make some cereal. Just take the bin out, and then when she comes back, it might not sound like much, but it's that little difference.
And I think we can just try to use positive affirmations and some coping statements like you used to do it and you can still do it. You can start with with five minutes. You can just start with one day. Eventually, you are going to excel and you are going to do it because you have the power to do it. You have that strength to do it, like just like you used to do it before. So you can still do it.
Yeah, absolutely, inshallah. So letting them know that they have this capacity in them, and it may not feel like it, but that fact remains that they have, they were created by the best of creators. Um, so in terms of Chloe, non-Muslim, but for a Muslim, absolutely yes, we could mention that. But like you said, for Chloe, we could give positive affirmations, absolutely. So she could write them down. It might be an app, kind of for quick access on her phone, that kind of thing. And just a quick reminder, a bit of a kind of bringing it together. How does BA fit into CBT? So the CBT model, it's over there. I won't repeat it. You can have a look. Why does it work? How does BA kind of fit into this framework? Breaks the cycle of avoidance, right? That inactivity, sorry, which causes low mood, contributes to low mood, and it kind of goes round and round. So it's about saying this little action that you can do to kind of break that cycle, and then consistency. Finally, there were a few questions that were put in the group chat, the registration link, etc. Um, I think I'll only be able to answer one of them, but I will answer the rest of them in the group chat if uh if there's interest. So, how is physical health linked to depression? This is a big question, but essentially, physical well-being, especially your gut health. So most of your serotonin. So serotonin is a chemical in the brain, um, and it is responsible for regulating mood. And actually, it's a lot of it is made in your stomach, in your gut, to be specific. So kind of eating healthy, that kind of thing, will help improve mental health outcomes. Physical activity, so 5 minutes outside in the fresh air, getting that natural light into your eyes first thing in the morning. All these small things can help to kind of ease symptoms of depression. Right. That's everything. That's everything from me. I've gone 1 or 2 minutes over. Hopefully that's okay. But Jazakallah khair for joining everybody. I'm very thankful that you've kind of spent your hour with me in your afternoon slash evening um listening to this. And yeah, so I've just put my LinkedIn here. So if you want to kind of check out what I write about, what I do, feel free to do that. Feel free to message me. And yeah, thank you so much, everybody. Jazakallah khair. Thank you. I'm glad it was enjoyable.
Thank you so much.
Jazakallah khair. Allah Hafiz.
Okay, thank you.
Ameen. Thank you, Abiyas. Very lovely of you. You're free to go if you wish. You're free to go.